Hello, I'm Adele Houghton, a Doctor of Public Health student at the Harvard T.H. Chan School of Public Health. I'm also an architect, and I've spent the majority of my career working with green and healthy buildings. That is, helping the industry build and operate buildings that use fewer natural resources and promote healthy living. There's a tendency in both the building sector and in public health to try to address one challenge at a time. So one project may focus on climate change, another on controlling infectious disease, and a third on health equity. But in reality, all three of these topics intersect and influence each other. They are complex adaptive challenges that will resist single targeted interventions. I wrote this article with the idea that we might be able to use the COVID pandemic as an example of how to break out of that tendency to focus on one problem at a time. The article uses the public health concepts of co-benefits to consider how building upgrades that are primarily aimed at reducing the risk of transmission of the SARS-CoV-2 virus can also be ranked according to how much they address climate change and social equity. To give you a quick example, COVID-19 is primarily spread through airborne transmission. A single issue approach to upgrading a facility with only COVID in mind might increase the volume of outdoor air introduced to the building and upgrade air filters. A co-benefits approach, on the other hand, might also consider ideas that would reduce energy use and increase occupant access to nature by installing window and door screens and fans, and even making outdoor spaces more accessible for working and studying. As the world begins to look towards a post-COVID future, leaders like President Biden and the World Health Organization have called on the private sector to use this moment as an opportunity to make tangible progress on climate change and social equity. The co-benefit approach is one way the building industry can respond to that call. I hope you enjoy the article.